Good evening. Welcome to the Drug Advisory Council's webinar on vaping and marijuana lung. My name's Jan Kronberg and I'm the National President of the Drug Advisory Council. We call ourselves DACA, so I'll refer to us in that manner from now on. I'd like to welcome people from all over Australia. We have people who have joined us from Queensland, from New South Wales, right throughout Victoria, from Tasmania, from South Australia and Western Australia. We also have guests from overseas, in particular our guest speaker back in November, Pamela McColl, who's joined us from Vancouver in Canada. I'd like to especially acknowledge a number of people who are with us tonight. First and foremost, we have one of the patrons of the Drug Advisory Council, Rabbi Dr. Shimon Cohen, Elaine Walters, OAM, a member of our Public Fund Management Committee, Rosanna Bainey, OAM, Dr. Alexander Callis, who is one of our patrons. And I'm very pleased to say that we have here in Victoria the Shadow Minister for Health, Georgie Crozier. Welcome, Georgie. And new members to the Victorian Parliament, Mrs. Anne-Marie Hermans, who is the member for South East Metropolitan, and Gail Broad, who's the member for Northern Victoria. So there are lots of other people who play important roles in the community here in Australia, and we have a very large number of people listening to us tonight. So it's a great delight to welcome you all. I want to encourage you, as you listen to our very special guest speaker, Dr. Murad Ibrahim, who I'll introduce shortly, I want you to consider texting some questions that we'll put to him in the second half of our time together this evening. So the phone number for that will be shown on the screen shortly. And I also want to thank those people. So there's your opportunity to text a question through to that number, 0447 160 990. And I also want to thank those people who very generously made a donation at the time they made the booking for this event. I want to thank you very much for that consideration and that generosity. If you're in a position to donate to us during the course of this event by visiting daca.org.au/donate, we welcome your donations. It helps us tick over. We're not a charity yet, so we have limited means to function by, and I just want to say that we're in the course of applying to be a charity. It's quite a torturous and expensive process, ironically, and we'll let you all know when we get to that high point, which we hope will be around about May this year. And we can all celebrate together that the Drug Advisory Council becomes a registered charity here in Australia. So without further ado, it's a great delight for me to have the opportunity to introduce to you Dr. Murad Ibrahim. Now, Dr. Ibrahim is a patron of the Drug Advisory Council and a very staunch supporter of our work. He's with me now, and while I want to put into context the fact that, as you can see through all our advertising material, he has many qualifications in the field of medicine, and he has specialty as a respiratory and sleep physician. Now, we've talked about the fact that he holds the position of Medical Director of the Knox Private Hospital, but he's not representing the Knox Private Hospital tonight. He's here in his personal capacity as a medical professional. He's also fully trained in intensive care medicine, and he acts as a clinical lead for quality and safety, and is involved in the assessment of clinical emergencies such as drug overdoses. Now, one of the roles he's had in the community as the Secretary of the Coptic Medical Association of Victoria, and he's not representing that body tonight either, but he's part of his credentials as an esteemed medical professional and part of the Drug Advisory Council or family, so we're very proud to have him here. And now he's going to explain to you the negative outcomes of illicit drug use and the harmful effects of vaping and smoking marijuana. So it's a great delight now to be able to invite Dr. Ibrahim to make his presentation to you tonight, and there will be a lot of material for you to take on, so I hope you are in a comfortable position and you can absorb what he has to say. So Dr. Ibrahim, if you would share some of your views with us tonight.
Thank you, Jan, for the kind introduction. It's a privilege to be here and be part of DACA. And I'm very well aware of all the efforts you put in and all the committee members. And thank you, Gabriel, for the technical support tonight. So I wanted to talk about vaping and marijuana lung, or cannabis in general. It is a true concern in our society. So the data suggests that Australia and New Zealand are second behind North America in the prevalence of cannabis use, about 12% or 3.4 million users. Compared with East and Southeast Europe, which is only 2%, and Asia, depending on the area, is between 1.2 and 2.6%. So a significant problem. 10% of cannabis users have what we call cannabis use disorder, which I'll define in the next slide. About 1 in 10 people aged 14 and over have been a victim of an illicit drug-related incident in the previous 12 months. And 1 in 5 victims and 12% of offenders had consumed illicit drugs before a homicide incident. So it's a significant issue. Cannabis is the most widely used illicit substance among adolescents aged 12 to 17. So what is cannabis use disorder? It means that people are dependent on it. They get tolerant to it, meaning that they need more to get satisfied. They have persistent desire for use. They're unable to stop or wean down. They spend a lot of time trying to obtain cannabis. They may fail to accomplish work or duties. They can give up social, recreational, or occupational activities. They continue usage despite physical, psychological, and social harm. And when they stop taking it, they get withdrawal symptoms that are relieved by taking more cannabis. So what's the composition of cannabis? So there are many substances, more than 400 identified, and I won't mention the names there, but they're on the slide. These are the classes. So a few of the chemicals have been fully characterized pharmacologically, but the most important ones in recreational cannabis is THC, which causes euphoria or feeling high. It has sedative effects, so making people sleepy, and it's got analgesic properties and acts as a painkiller. So what can happen with cannabis use? People get mild euphoria, they get relaxed, and they may have reduced inhibitions. They may have altered perception and judgment. They may not be aware of time, and ordinary events may be intensified. They can feel hungry. They get panic reactions. They can feel paranoid. And this is mainly in naive users who haven't used it before. They get nausea, headache, increased heart rate, dizziness, impaired balance. But also they can have long-term side effects, which I'll detail a bit later. But that includes dependence, as mentioned, cancer, chronic respiratory disease, cardiovascular system problems, mental health conditions, and poor psychosocial well-being. Is it a serious problem? Yes, it is. It can lead to hospitalization, so about 134 per 100,000 population need to call an ambulance. In younger people, it's even higher, up to three times that, 341 per 100,000. Hospitalizations, about 29 presentations per 100,000 population, and 2 out of 3 of those require an overnight stay. And the rate of hospitalization, unfortunately, is going up. It's increasing. It's been estimated as 7,500 in 2021 versus 6,000 in 2017. Cannabinoids were present in 6% of all drug-induced deaths. It has psychological effects. So these conditions listed there have been associated with marijuana use, including depression, bipolar, psychosis, schizophrenia, anxiety disorders, PTSD, poor adolescent psychosocial development, social isolation, etc. And it can lead to cancer. So in particular, is what we call small cell lung cancer, was shown in a large study involving 85,000 individuals, but not other types of cancer in the lung. Can also lead to testicular cancer, one in particular called non-seminoma, which has been associated with use for more than 10 years. And the odds of developing the cancer are almost double that of someone who hasn't used before. There is some talk that it may cause upper airway cancer, but this is not proven. Cardiovascular complications can lead to heart attacks if people use more than 10 times a month. Can lead to potentially causing a stroke, even in younger population who should not really have a stroke at the age of 18 up to 49. Can cause arrhythmias or irregular heartbeat, and the commonest being what we call AF or atrial fibrillation. And it can also cause life-threatening tachycardias called ventricular tachycardia that generally we need to give a shock for. It has side effects on reproduction and lactation, so there is decreased sperm formation and function in males. It can also appear in breast milk at relatively high concentrations, even after a few weeks from cessation. And it can lead to increased risk of low birth weight. It has effects on cognitive function, such as lack of attention, concentration, memory problems, learning problems, processing speed, and executive functioning. It can also possibly lead to dementia long term, but there are some more studies going on about this. It can lead to what we call hyperemesis syndrome, or in other words known as cyclical vomiting syndrome. It happens mainly with excessive marijuana use, more than daily for 1 year at least. It's worse when mixing it with alcohol. It can cause severe intractable non-stop vomiting and abdominal pain, and it can last a few days with treatment being ineffective generally. So below is a case report, one of my patients that I used to see a few years back, who was a young male, 18 years old. I've looked after him for about 3-4 years, and once or twice a year gets admitted to the hospital with non-stop vomiting, crunched in bed every 2 minutes, cannot stop it, and eventually gets discharged 4-5 days later, only to come back again 6 to 12 months later. So it just shows you how addictive this is. Other side effects of marijuana use include dry mouth, inflammation of the gums, white coating of the tongue, redness of the eyes, they become dry, increased sensitivity to light, and acute deterioration in chronic liver conditions. So people get what we call encephalopathy, where they become comatose or confused. So mainly we wanted to talk about effects on the lungs, and as you can see from the picture there, it damages the lungs, and I'll describe that in a minute. But it can cause chronic bronchitis, which is chronic coughing and irritation of the airway. It can lead to emphysema, which is destruction of the air sacs, leaving holes in the lungs. So if you can see here on the left side, on the periphery there, this is a relatively normal lung. It's not completely normal, but close to normal lung. But you can see that on the bottom there, there is a big hole in there. That's what we call bulla, and that's what emphysema is. On the left side of the lung, you can see multiple bullae on the side. So both of these conditions, the emphysema and the chronic bronchitis, can lead to something called COPD, or chronic obstructive pulmonary disease, which is chronic narrowing of the airway leading to inability to expire air, and what we call a barrel chest or a hyperinflated chest. It can also lead to chronic inflammation in the lungs, and again on the right side you can see all the white material there. That is inflammation from marijuana use. Again, other pictures showing a large bulla here at the top, in the picture on the left, and you can see it also on the right side in multiple areas. And this is quite a rare complication called vanishing lung syndrome in a marijuana user. You can probably see there it's all black on the right side, and that arrow there shows the collapsed lung, which is really only tiny to the size of the thorax. And again, similar picture on the right. So this is the second case presentation. Was also a patient of mine, a 39-year-old male who works as a painter, who used to smoke both marijuana and cigarettes. Used to see them and monitor the lung function, which gradually showed deterioration. The patient continued to come back because they were concerned about their health and the lungs and wanted to measure the lung function. And because of the concern, they eventually were able to stop smoking. But despite the continued decline in lung function, unfortunately, they could not stop marijuana, and this shows you how addictive this is. So the key messages are, marijuana use is a significant health concern in our community, particularly in the young population. It's highly addictive, increases the risk of hospitalization, has significant long-term complications both from a physical and a psychosocial context. There's a call for action to combat the problem at multiple levels, not just from the health perspective, but also, it needs to be done across, schools, local councils, and even religious institutions and social groups. I'll conclude with this about marijuana, and we'll talk about vaping and e-cigarettes next. So this is defined as the process of inhaling an aerosol that is created by heating a liquid or wax containing various substances such as nicotine or cannabinoids, as well as additives such as flavors. This started in China in 2003 and reached the Western communities in 2006. Although originally it was made or manufactured by small companies, later on large tobacco companies acquired these smaller companies and started to produce their own products. You can easily see the conflict of interest here because sometimes they promote these products as a method for smoking cessation. I'll talk about that a bit later. There have been different generations of devices that evolved over the last few years, including 5 generations, including some disposable e-cigarettes instead of the usual sort of rechargeable one. So ingredients of e-cigarettes include potentially nicotine, ranging from 6 to 36 milligrams per mil. What we call a humectant, which is basically something to keep it moist in a liquid form. Propyl glycol or glycerol and ethylene glycol are the 2 commonest ones. There are up to 7,000 flavors, from mint to fruit to other ones. But when they've done studies on these e-cigarettes, they found other substances such as tin, lead, nickel, chromium, manganese, and arsenic, and also tobacco-specific products such as nitrosamines, metals, volatile organic compounds, and phenolic compounds. Vaping devices can be used to also aerosolize THC or cannabinoid CBD oils. So what's the problem here? 100% of these e-liquids were inadequately labeled. 100% contain chemicals with unknown effects on respiratory health. 21% contain nicotine, despite this being illegal in Australia. And 62% contain chemicals that are likely to be toxic if used repeatedly. And next I'll be showing a study that was done and published in the Medical Journal of Australia last year, where they analysed 65 samples of e-cigarette liquids, and the results showed that the measured levels of propylene glycol and glycerol often diverge from those recorded on the e-liquid label. All e-liquids contain one or more potentially harmful chemicals. They're listed there, but I would like to highlight hydrocarbons and nicotine in particular. In conclusion, they realized that Australian e-liquids contain a wide variety of chemicals for which information on inhalation toxicity is not available, and further analysis are required to assess the potential long-term effects of e-cigarettes on health. So what's the incidence of vaping? About 22% of Australians, or 1 in 5 people, aged 18 to 24 have vaped, and about 7.6% of 15 to 17 years old have vaped. And these numbers are likely underestimated according to the Australian Bureau of Statistics. So the situation in Australia is that it is illegal to sell or buy nicotine for use in e-cigarettes to anyone without a prescription. Unfortunately, this is not very well regulated. A lot of these products are imported from overseas, and we have very little control on how they're manufactured or what's in them in particular. Our government has done quite well in raising tobacco awareness, but now it's time to address the vaping issue more strictly. It's a very topical issue at the moment, and the Australian Medical Association and the Heart Foundation are requesting action to enforce stricter regulations to regulate nicotine vaping products. And the Therapeutic Goods Administration have proposed these reforms and asked for submissions on those, and this included changes to border controls for NVPs, pre-market assessment by the TGA of all NVPs, strengthening of the product standard regarding minimum quality and safety for NVPs, and also clarifying the status of NVPs as therapeutic goods. So what are the adverse effects of vaping? Well, nicotine can cause heart attacks, it can cause rapid heart rate or tachycardia, it can promote thrombosis or blood clots, it can potentially lead to strokes, it's got negative effects on the developing brain in adolescents, and it can also lead to addiction. It's well known that vaping is associated with increased risk of future uptake of cigarette smoking. This is a special condition that can happen with e-cigarettes, what we call EVALI, or e-cigarette or vaping product use associated lung injury. It's been recognized in the US in the summer of 2019, and by February 2020 they had more than 2,800 cases hospitalized in the US because of that. 80% were younger than 35 years old, and 22% had underlying asthma. The incidence is generally higher with THC consumption with vaping, and even without THC, 13 to 58% use nicotine with or without THC. 573 reported using products off the street or giving to them by family or friends, so basically unlabeled. What's the pathology of EVALI? It's a type of acute lung injury, and it includes a spectrum of conditions, including inflammation, hemorrhage inside the lungs, allergic reaction to the vape, and what we call respiratory bronchiolitis interstitial lung disease, or RBILD. And this is associated with, guess what? With smoking. So people that say that vaping, is less harmful than smoking, well, there is evidence there that you can get similar conditions in both. Symptoms of EVALI include shortness of breath, chest pain, nausea and vomiting, diarrhea, fever and chills, coughing up blood, and low oxygen levels. These are pictures to show the effect of vaping on normal lungs. So on the left-hand side, you can see a normal lung, and basically normal lung is generally dark grey with white dots in the middle, which are the blood vessels, and you can see the heart and the blood vessels in the middle there. You can see on the right-hand side of vaping lung, you can see all this white inflammation on both sides, which is basically severe inflammation from vaping. This is another picture showing the same. Again, on the left-hand side here, you can see a relatively normal lung, but it's only a small area in the lungs. The rest of the lungs look very white and inflamed, and similarly on the right-hand side. So can it lead to serious complications? Yes, because this EVALI can cause 30% of people who get admitted to hospital to be on life support. 7% of them could not be sustained on a ventilator, and they require a heart-lung machine, so they have to put cannulas in the groin to give them oxygen artificially straight into the bloodstream, not using the lungs because they cannot oxygenate through the lungs. Unfortunately, 68 patients died, which is about 2.4% death rate, and the prognosis was generally worse when patients had another health problem. Broader risks to the community, it's a public health concern, you know, all the rates of admissions to hospital, the effect on adolescent health, you know, reversing the gains that we made in smoking cessation effort because it can promote people to take up smoking again. Reports of poisoning in children, you know, with respiratory exposure, they just see it on the table or something and they can use it. And there are concerns about secondhand aerosol exposure. So the key messages are that a lot of the e-cigarettes are manufactured by tobacco companies. They put in all these flavors to make them more attractive, particularly for young people, and hide what's in them. A lot of them are mislabeled, so you don't actually know what you're vaping. And vaping has been promoted as an effective method for smoking cessation, but this remains controversial. It's not really robust evidence. Majority of people who vape believe that it's a tool to quit or reduce smoking, and as you could see earlier, it can cause serious short-term side effects or complications such as EVALI. Now forget the scientific jargon that I mentioned earlier, let's just talk about it in common sense. Our respiratory system is designed to breathe in and out air, not other things. So we don't really know the long-term side effects of these products in there. If you want to think about it, you know, the simplest example is tobacco in the early 1900s, you know, when it came out, a lot of people were using it or giving it to each other, but over the years we realized it can cause cancer of the lung, the stomach, the bladder, the colon, etc. And it can cause emphysema and COPD, as everyone knows. Later on, asbestos came out in the mid-1900s, and again, people were using it, not knowing what the effects on the lungs, and as probably most people know, it can cause the mesothelioma, which is a nasty type of cancer. Again, similarly, you know, occupational lung diseases, you know, if you inhale, you know, silica, you get silicosis. So the lungs are designed just to breathe air in and out. These products are addictive, so it's best to resist use from the beginning. People do struggle, as per the examples I introduced earlier. And as you can see from the slides earlier, the medical authorities are calling for stricter regulations, so there is obviously a signal of concern out there. So thank you for your attention. I have no conflict of interest, and I'm happy to take questions.
Dr. Ibrahim, thank you so much for that presentation. I think it's worth mentioning that during some free time just yesterday, Dr. Ibrahim prepared those slides himself. So it's not a cut and paste. It's his own personal input. So that amount of commitment to our webinar tonight, as well as what he's shared and the emphasis that he's placed on that information, it has been very, very important, and I know you're going to take in this message. And I can see by the sort of questions that are coming through that a lot of people are responding to this and concerned. And one of the questions I have here is that, and I'll put it to you, Dr. Ibrahim, lobbyists, the Australian Taxpayers Alliance and Legalise Vaping Australia selected MPs following a 2018 parliamentary inquiry, and in particular the policy position of a group, the Liberal Democrats, with the main argument being pushed is that vaping helps people to give up smoking cigarettes. What response would you recommend? And that's a pretty tough question.
Yeah, look, as I mentioned in the slides, the evidence is not really out there. I mean, yes, you know, the tobacco companies promote it, and in some countries they do mention that it can help, you know, smoking cessation, but it's not robust evidence by any chance. And as I've, you know, mentioned before in the slides as well, it can actually make people take up smoking rather than, you know, stop smoking. So, you know, It's not a recommended method for stopping smoking, and we do not recommend that in our practice.
I have another question here for you, Dr. Ibrahim. Would you share any thoughts on a campaign to dissuade young people from vaping or using marijuana? This is from Terry here in Victoria. As with tobacco smoking, vaping and smoking marijuana produce foreign particles into the respiratory system with serious health consequences. And of course, this is a point that Dr. Ibrahim has just made. What are your thoughts on a campaign similar to the Quit campaign, which has greatly reduced the incidence of tobacco smoking, zero tolerance, actual photos showing damage done to the throat, tongue, mouth and lungs? The photos could be contrasted with images of the healthy activities adversely impacted by vaping and smoking, such as athletics, swimming and team sports.
Yeah, I think this is a great idea, and I totally support something like that. I think I did mention in the slide that it's not just the health department role, but also, schools, local communities, councils, etc. We need to spread the word. We need to show, pictures of the damage that can happen from vaping. We're quite happy to be engaged, to give talks to schools, and I'm happy for to be shared around that we need to get the message out there to the young people, because it is a problem, and it is very addictive, and people can use it for years and years. So unfortunately, work needs to happen in this area, and I'm very supportive of getting a campaign out there.
Oh, thank you very much, Dr. Ibrahim. It's great to have your endorsement for such a thing. As DACA forges ahead with its endeavours and with its partners, such as our coalition of the drug prevention bodies under the umbrella of the Task Force for Drug Prevention, we'll be placing emphasis on that direction during the course of this year, I hope. Now, another question. Vaping is becoming new smoking with our young. This is from Kirsten here in Victoria. Many school-aged teenagers are using, thinking that it doesn't do the sort of damage that smoking does. How are we going to get this message through to them? Should we consider similar messages as we do cigarettes? There you go. Great minds think alike. It's a very similar question to one put before, Dr. Ibrahim.
Yeah, absolutely. I think we need to get the message out there. It's a widespread issue, and a misconception that vaping is less harmful than cigarette smoking when it isn't. And obviously the evidence is there in the talk. We need to show them pictures like this. Like we have all these ads on TV about smoking cessation, and they can show the damage to the lungs. Well, we need to do something like this for vaping as well, because in fact, tobacco smoking is going down, and vaping is going up. So it is our new problem at the moment that we're facing.
It's our view, Dr. Ibrahim, that what we call big tobacco 2.0 is, in some ways, this is the vaping product, especially in Western nations where there has been campaigns like what we see here in Australia, the Quit campaign. So people are paying attention, and I think the rate of smoking in Australia is quite low. I think it's somewhere between 15 and 12% of people who are smokers now, and so those campaigns have worked. Where, of course, there are nations that haven't benefited from the government being on the front foot in these areas, and smoking levels are quite high, particularly in the third world. So the tobacco companies have had to look to alternative product lines, and so we're actually seeing another product line being introduced with the benefits arising accordingly from clever marketing campaigns. So I'm just going into the next question for you, Dr. Ibrahim. this is a very interesting question. I'm not sure the name of the person, but it's an Australian phone number. And the question is in two parts. The first one is, can vaping cause pulmonary embolisms? Thanks. Then the next part of the question is, 4 months into vaping, I had multiple blood clots and my lung and was worse and in declining health.
It's not a very well-known phenomenon that vaping can cause blood clots in the lungs, but again, it depends on what products were used. So as I outlined earlier, unfortunately, we don't know what's in these e-cigarettes. Half the time, the chemicals inside are not, labelled, and it is quite possible that it can cause it, but it's not a well-known complication. Deterioration in lung function would most likely be in relation to the direct vaping effects on the lungs themselves. But obviously having pulmonary embolism would not help, so that would also reduce the lung function further.
Thank you very much. Another question, this one's from Tasmania. It's from Tanya in Tasmania. Not all young people who are vaping, I just have to make sure that the typing's right. Not all young people who are vaping are known to be vaping. I guess that's because would teachers and parents know about it. What could should parents teachers be looking for as signs that there are very real health concerns? And how should they approach this with the young person, in your opinion?
Yeah, I mean, it depends obviously on what they're vaping. If they, vape nicotine, for example, well, it has its addictive properties, of course, so they would be trying to seek, getting more and more. But it can also, lead to breathing problems, shortness of breath, coughing, etc. If there's something else, in it, then, looking out for, hopefully it's not THC, but like things like that, can cause, euphoria and sort of unusual behavior, etc. So I think you just need to keep a close eye on our children, and maybe if there are concerns, just speak to the school, and I'm sure they'll have sort of better surveillance systems there.
I certainly hope so. I had a look at the Victorian government's Victorian Department of Education's website today, just to see, because one of the reasons we're having this event tonight is because in Victoria, children started to return to school yesterday, and of course the uptake will continue through the week for the younger children and private school systems and so on. So this is the return to week school, and we've heard lots of stories in recent times about the kind of positions children perhaps going to a secondary school for the first time, a totally new experience, a child entering year 7 on a new campus with a lot of older people as fellow students who've gone through puberty, and so it can be quite confronting for young people entering the secondary school life in the early days. And we've been told about the fact that young children are approached to start vaping, and even though with the best intention of the education department, teachers, school principals, their professional organisations, somehow or another children are approached in the locker room or in the toilets, and they're encouraged to start vaping by older children in that school. So we would like to make this point tonight and underscore our concern. And it's one of the reasons why, and I'm very pleased that that question as to what signs would parents and teachers look for if young people are secretly taking up vaping, stroke, succumbing to the pressure to take up vaping. And we're hoping that through this event tonight that we give you some information and hopefully provide the impetus for you to speak to members of your family, your neighbours, people in school authorities. If there are any community leaders out there who could be on the front foot on this matter, raise this subject with school authorities, the school organisations, through the parents and teachers' bodies, at school assemblies, so that there's a heightened awareness that there's a kind of a subculture. No matter what the intentions are in the school, there'll always be something, and we all know from our own experience the sorts of things that might be going behind, in inverted commas, behind the shelter sheds. And so we want to alert you that there's a distinct possibility that young people could be under pressure to start vaping. And it's not necessarily, they might be tempted, they might think it's a good idea, they might feel that peer pressure encourages and underpins those sorts of decisions. They could be told that, and we know because of the material that Dr. Ibrahim has presented to us tonight, we know that it does lead, vaping, especially in young people, does lead them to actually taking up cigarettes. Our concern also is the fact that vaping can be a device so that cannabinoids can be inhaled through the device, and this could be one of the motivations in the school communities when younger people are persuaded to take it on board. Now, there are guidelines, according to the Victorian Education Department, that I think need to be firmed up, and they underscore the fact that it's illegal for children to have these. Nobody under 18 should have one, and vaping shouldn't occur any closer than 4 metres to the school gate, and all sorts of things like this that in some ways it's almost like turning a blind eye and a tacit acceptance. So as a community of interested persons, of interested parties, the organisations that you represent and you belong to, these are the things we're hoping that you'll support our endeavours in getting these messages out and getting on the front foot, ringing up Talkback Radio, writing letters, and especially approaching members of Parliament who are stretched to the limit in many ways in terms of what they have to achieve in their working year, and they need all the help they can get so that your initiatives can provide focus for them. So.
I'm glad you mentioned about peer pressure, Jan, because this is one of the things I used to tell my children all the time. You know, just do not, you get tempted, people will tell you, nothing will happen, just try it, it's fun, it's all that sort of stuff. And I kept saying, do not even touch it, do not go near it. And I kept saying the same thing all the time. So yeah, it is an important message out there. Just, it starts at home, put it in our children, do not touch this stuff. No matter what peer pressure, you just have to say no, and then you stick to your guns.
There's a saying amongst our community of drug prevention organisations, it's not even once. It's very important saying or a mantra, not even once. Now, I've got a number of other questions, and I really have to forge on with those, Dr. Ibrahim, after my mini editorial just then. So, Dr. Ibrahim, in your opinion, is there a difference between dependence and addiction?
Well, I suppose addiction is more the medical terminology for dependence. So basically, when someone is addicted to a drug, they cannot stop using it, so they are dependent on it. There are subtle differences, but they're basically one and the same.
Okay, there's another question here, and it relates to statistics. Are there statistics available in Australia on, and someone's picked up on the terminology EVALI, E-V-A-L-I, that was the acronym that Dr. Ibrahim covered earlier. Are there any statistics yet in Australia on EVALI numbers?
I haven't seen any. I mean, I can do a bit more search. If you're interested, we can get back to you with the answer. But this data was published from the United States. I have seen personally people with, vaping-related, lung disease, not to the extent of needing the intensive care unit, but, a significant problem. But I don't know, I don't have the data, and I'm not even sure that there were any that published, but I can try to look it up and see if I can find something and we can send it to you.
Well, thank you very much for that gesture. That would be a valuable resource, and we can post that to make it readily available for those interested in those statistics. And can I just say parenthetically, I'm very concerned in terms of the contrasting number of statistics that one finds looking at the drugs questions and its impact on individuals, public health, on society, what's available through the research endeavours and statistical compilations in the United States, which is in steep contrast to what's available in Australia. So perhaps there should be more funding directed to that just alone. We have another person here from Victoria, and the last question was from Joe in South Australia. John here in Melbourne has said, do you believe that Australia's pro-drug elites in government departments and the media are merely misguided in their views? Why then are they so impervious to the well-attested evidence that marijuana in particular is extremely harmful to a user's mental and physical health?
Yeah, definitely it is harmful, but we do have medicinal cannabis here in Australia, so there are some indications for use, and it has to be very strictly regulated, and it is. So no one can just prescribe, medical cannabis just like that. You have to apply to the government, etc. But definitely it is a harmful substance, and promoting it for particular reasons for medical purpose, should be okay as long as it is well regulated, because as I did mention in the presentation, it does have some analgesic effects, and it may be useful in certain sort of categories of patients, but we really need to keep it tight.
This question is from Andrea in Queensland. Hi Jan, I have a question. I started late, sorry. Can people put ice in vapes? Ice or meth?
I'm not sure. Maybe.
Yeah, that's a good question. Andrea, she is somebody we know well. She runs the Australian anti-ice campaign out of Queensland, so that's her question. But that's a good question on notice, perhaps.
Yeah, we can have a look at that too.
We'll have to have that one on notice, Andrea. Yours is a specialty, of course. And we've got another question. I'm not sure who it's from or where. It's just a number here. I haven't got a name. It says, it could be from Victoria. It says, as Victorians elected 2 cannabis members to the state parliament, is society beginning to accept illicit drugs?
That's what we're trying to say, is that, you know, we don't want that to happen. We want good legalization, and making sure, any medical cannabis or any drugs that can be used for medical purposes is strictly regulated. Obviously, we do not support sort of recreational sort of drug use, but obviously, people will have different opinion, and depending on what they read and what sources they got the information from. But hopefully, the message is loud and clear that these drugs are harmful, particularly if unregulated. Certainly recreational use is not recommended at all. And even if we use it for medical purposes, this needs to be strictly regulated. And we need to also, as mentioned in the slides earlier, we need to regulate the importation of some of these, e-cigarettes that come from, everywhere basically, and we don't know what's in them and how they're manufactured, and all the potential harms that can happen because of that.
Thank you very much. Somebody said, can you please list the references again as they flash too quickly? Well, to this person who's asked this question, what I can say is this broadcast is, just for your information, is going out through YouTube. So you can search for this event on YouTube, and you'll be able to access that information at your leisure. Or another way, you could text me your email address, and we might be able to email it to you. So we're very happy to share that sort of information. Now, I'd like to just share an interesting comment with you that I think is worth sharing tonight as well. And that's the fact that just yesterday I ran into my local Member of Parliament, the federal member for Menzies, and he said to me, I've known him for some time, and he said to me, oh, I've just returned from Washington, and he gave his apologies because there's other events on for federal members of Parliament in Melbourne this week, and especially tonight, and he can't be with us. But so as he tendered his apology, he said, I was in the United States last week, and and we got special briefings when we were in Washington, and he gave a lot of focus to how very concerned authorities in the United States are with the fentanyl scourge and what that is doing. And so we know that each year for about the last 5 years, approximately 100,000 young people have died of fentanyl overdoses in the United States. So they are open in keeping those sort of statistics. And so that's a general comment, but what's relevant to our topic tonight is the fact that in addition to their focus on fentanyl, that the message he received, and I'm going to ask him to give us the information as well as a resource for us at DACA, and that is that in Washington last week they were talking about the direct correlation of vaping as a means for people to become addicted to cannabis. So, hot off the press, Out of Washington, the news is only a few days old. That is something that underpins all of the important information, the facts that Dr. Ibrahim has shared as a clinician, as a respiratory specialist, the points that he's made, what he sees in his practice, what he sees in clinical settings, what he sees in ICU environments. These are the facts. This is as we speak. Somebody may well be suffering, and we hope that that's not the case. But because the incident is growing and it seems to be widespread, especially throughout this nation, especially when we've talked about the levels of cannabis use in this country, second in the world behind the United States. Those frightening statistics, it is likely that as we speak, people are suffering from the effects of marijuana lung, marijuana use, and all the mental health problems that follow from that. Also, the effects of taking up cannabinoids, especially THC, through the method of vaping. Now, if you are a young person who was already addicted to a substance, such as cannabis, you might be in year 9 or 10 in a high school, you would like to target a year 7 child so that they started to take this on as well. And so children in secondary settings, unfortunately, I hope this doesn't cause you a sleepless night, but that's where a lot of the drug dealing is going on amongst teenagers. Young people become addicted, and then they essentially must become drug dealers, even if it's on a small scale. It's certainly a reality. Now, I have another comment here that I think is worth sharing. And we refer to this comment which highlights the work of Dr. Stuart Rees, and that's shown that both THC and very concerningly CBD, which is the less harmful component of cannabis, which is being promoted as medicinal, is causal in more cancers than tobacco. And they also causal in 89 of the 95 birth defects, plus mutagenic and genotoxic. Should we be very cautious about promoting marijuana medically without outlining the real harms? Now, I think this is a really powerful topic, and I'm not sure whether we can go into it with the very limited amount of time available, but I'll put that to Dr. Ibrahim for a comment.
Yeah, I think, as I said earlier, I think this question is more for organisation like the Therapeutics Goods Administration to look into these things, because it needs a lot of study, and we need to dissect that evidence and make sure that it's a robust evidence. But as I did say earlier, I think medicinal cannabis has got its place, but it needs to be very well regulated. It needs the patients need to be supervised. It's not just any person who complains of non-cancer pain, then we prescribe that just easily like that. It needs a lot of strict criteria to be able to use it in the right way, and if we control it that way, then we'll get the benefit out of it rather than the side effects.
Yes, thank you very much for those comments. Now, as we're moving to the close of our webinar tonight, I did want to remind those of you who are with us that we're very grateful for those of you who have made donations to us. Every mickle makes a muckle, as my Irish grandmother used to tell me, and so we really do need your material support. So if you're in a position to make a donation to us as a result of what we're putting to you tonight and what we'll put to you in the future, that's an opportunity to help us, and as I said, in a very material way. So daca.org.au/donate. And in anticipation of that generosity flowing through to us, I thank you most sincerely. We'll let you know when we are poised to become a registered charity. We'll be sharing that. And also, in a very short space of time, we'll be letting you know as to what our next webinar and guest speaker will be all about. Some of the subjects that we're looking at the moment will be what fentanyl does and its meaning to people here in Australia. Seeing 100,000 young people have died of it in the US each year for the last 5 years, and it comes in to Australia. Precursor chemicals are produced in Asia, and it's coming through. So we want to warn you about the dangers of that as well. And there are a lot of events that we're planning for this year, and our guest speaker at the end of November, our last webinar guest, Pamela McColl, who's participating with us tonight from Vancouver at a very strange hour for her, that she may be doing a speaking tour in Australia this year, and we'll advise you of all our activities and our events, be they fundraisers or important exchanges of really important, authoritative, well-researched information, so that you can take it home to your families, to your community groups, to the school bodies, especially this message on vaping and its impact on lungs and the impact on public health, on future prospects of the individual. There were some alarming images that Dr. Ibrahim has shared with us tonight, and I'm hoping that it's one of those things that those images, once you've seen, they can't be unseen. And if you would like to make sure that those people who are in your orbit, in your network, in your reference group, belong to your community organisations, or share with the members of your family, this broadcast will be available on YouTube, and so it can be shared. And we encourage you to promote this messaging and this information. Now, without further ado, what I would like to do on your behalf is first and foremost thank Gabriel, who's made sure our broadcast tonight was picture perfect and ran smoothly technically. I want to thank you, each and every one of you who have forwarded such well thought out and important and relevant questions. Thank you very much for the effort that you've put into that. For people who are watching this DACA event for the first time, thank you very much for supporting us. We hope that the message that you take away is something that you can use, and that you'll join us again in the future. And of course, I want to thank Dr. Ibrahim most sincerely on your behalf for the effort that a busy doctor with awesome responsibilities in a professional setting, running his own practice, looking after his own patients, being the medical director of a hospital, undertaking almost continuous professional study so that he is right at the forefront of learning as a specialist. And yet he has carved out enough time yesterday to develop this presentation for us and to spend the evening with us tonight. So on your behalf, I salute him, I applaud him, and I thank him most sincerely for the valuable insights that he has shared with him tonight. I hope you'll come back and join us at future events for DACA, and I thank you all for watching tonight.